I'll start with the one on health. We have quite a number of properties that belong and are meant to be clinics, hospitals. We've got from level 1s all the way upwards. So the issue is how we can be able to maximize the usage of these and how that can be able to be user-friendly to the public as well. We're looking at ways that we can be able to say that economies of scale, how purchase of medicine and non-medical items as well can be centralized so that the county government, all its facilities can have a low rate in terms of purchasing of those. We also want to see, in terms of disease patterns in every area, a situation where how we can be able to now use existing facilities. And the first facility, whether in Likoni we need to have a possibility of having one unit being able to be transformed into just maternity, and these are just examples that I'm providing to you. And then thereafter as well, in terms of the level of workforce. So if at all we need to employ doctors or clinical officers or nurses, where they should be deployed in every one of these areas. And the composition of this for the health will have will be chaired by Dr. Chibanzi, I think, who is someone who has been in Mombasa for a while, Mochonda. And then we'll have a representative from the Kenya Medical Association. We'll have a representative from the civil society, a representative from the National Hospital Insurance Fund as well, because one of the things that we want to achieve and attain is health coverage for our people. These are some of the things that we promised in our manifesto. Sixth, community health volunteers, one drawn from every sub-county. The reason for this is they are the first people who are the point of seeing the patients, and then they are also extremely vital when it comes to issues to do with prenatal and postnatal care as well, issues to do with vaccinations. And then we're going to have the Chief Officer, Department of Medical Services, Public Health, Coast General Officer, and the County Secretary and the current Chief of Staff in the Office of the Governor. So those are the issues, and the terms of reference are very, very clearly defined. They will start meeting, and we are hoping that they will be able to provide us with this report in a period of about 30 days or less, where we'll come up with recommendations on how we should be able to overhaul the health sector in Mombasa county. And we want to look at ways that we're going to have long-lasting solutions. So this is something that is going to be included in our long-term strategy planning. The things that need to be done on short-term will be done on short-term as well. Then the next one, we have the Finance Task Force. Now, we're having a big issue right now. I've seen people asking us about pending bills. I've seen people asking us that the inspectorate is harassing them and they cannot be able to do businesses. I've seen people telling us a lot of things in matters of finance. So this particular team that is going to be chaired by Mahmoud Noor, and then it's going to have a representative of the Kenya National Chamber of Commerce, the Law Society of Kenya, Institute of Certified Public Accountants of Kenya, and we'll have the input as well and membership from the Kenya Revenue Authority, a member from the civil society, the business community. Mr. Ali Ahmed is here with us as well. And we're going to have the county secretary, chief officer of finance, the county attorney, and the secretariat will be at the office of the governor. The reason for this is very simple. We need to look at ways. We need to look at ways to optimize current collections. We need to look at ways on how we can be able to reduce the burden on the citizens of Mombasa. We gave a promise which we intend to keep. The next finance bill, which will not be part and parcel of this particular task report, the next finance bill will see a reduction in the PSV licenses. That means for the matatus and the tuk-tuks, we will see a reduction in the amount of money that they're paying. And then also, we are going to see the single business permits being joined into one, where someone does not have to pay matters of health separately, fire, and all these other issues. You just pay one single license. We're looking at ways as well to see certain institutions which, especially the hospitality, where instead of them also having many licenses, we try and figure out a way on how we can work together with KRA, and you pay us as and when you're able to do that particular business. There's something that is also a very ambitious plan that the county government will be doing, and that is an enactment of the Mombasa Revenue Services, which will be something similar to KRA, so that we don't have a situation where any single person starts, an Askari is currently working on the situation where we're collecting money and then that money is just disappearing. So sealing of these particular loopholes, again, I'm insisting on the fact that the economy of Mombasa is at a bad shape. So we cannot burden the citizens with extra amounts to be paid. However, we want to have an efficient way of collecting on-source revenue from the county. So the Mombasa Revenue Services is going to be a county corporation whose main role will be now to look at all on-source revenue from the county and have a DG. Of course, that is part of the recommendations that I'm expecting from the Task Force on Finance, so that we can be able to have one central point on on-source revenue of the county to be collected. And also as well, to liaise with the Office of the Auditor General in terms of the pending bills, and equally look at the projected income of the county vis-a-vis all the pending bills, and we come up with a payment solution for those who are genuine, verified pending bills as well. Needless to say, the county also has to go on with the agenda based on our manifesto and the projects that we intend to roll out. So these are some of the things that I'm requesting the task forces to be able to come up with. Considering that this particular task force is going to have an element of drafting laws, an element of looking at many other things, they are going to be, I've requested them to try and push it as much as possible up to 60 days. Meanwhile, this task force as well is going to come up with a rapid response initiative, and I'm glad that the team internally, before the task force has even been done, the team at the county itself has already started this. That means in terms of revenue collection, we're going to come up with a rapid response initiative with the same employees at the county. And I'm glad to note that just over a period of less than, I would say about 36 hours, in less than about 36 hours, we've already seen an improvement without necessarily hurting people, without necessarily harassing people, without necessarily increasing the amount of money that people have to pay, just by following down laws that are already there. We've seen already an increase of about 30%. So this is the direction that Mombasa wishes to take, where we're going to now involve every stakeholder on board.